Radhe Radhe friends, this is your friend Dr. Sheel Verma, consultant orthopedic surgeon, author of Radhika's Mahabharat and poet of Radha Krishna Gita. Once again, I have come to discuss something about exercises and lipid profile. But before diving into the subject, I would like to offer my gratitudes to my guru, Professor Satyanand. Professor Satyanand was head of department and our teacher at GSVM Medical College, Kanpur. One day, while we were in the clinics when I was in third year, out of context, he just said, the domain of orthopedics and orthopedic surgeon should be prescribing the exercises to the patients. That is, the exercises which are prescribed to the patient should be within the domain of the orthopedic surgeons. He said it when I was very early stages of my career, but I couldn't understand what he wanted to say. But later on, when I started advancing in my field, I understood what he wanted to say, and what he said at that time, it had really created a sea of interpretations, sea of knowledge with the exercises. But now, all of us, when we go to any medical checkup, there is a test of lipid profiles, and every test which is conducted with every patient in this country or everywhere, anywhere in the world, the lipid profiles are done. What is the lipid profile? What is the relevance of lipid profile in anyone? This is a question which haunts nearly everybody and every time. Well, most of the surgeons, they said, well, lipid profile is irrelevant to us. It doesn't have any gradual meaning because lipid profile keeps on changing very quickly. If you have a change in the meals, it will change, and it's not a very constant observation which can be made, but still it does signify some meaning. Now, coming to the words that what is the relation between the lipid profile and your exercises? Gentlemen, we all know that if we are using that there are various type of exercises we are using for our treatment and towards the daily routine also to keep us fit. To keep us fit, suppose if your sugar is higher, so you are advised robust exercises by the physicians. If your cholesterol is higher, the physician they says that you are at risk of the emboli, a thromboembolic phenomena, that is for the heart attack and the cerebral attacks, which can lead to harmful effects. So, when we come across these sort of reports that the lipid profile, in the lipid profile, either there's a rise of cholesterol or heavy density lipoproteins, whatever the category of lipids are increased, the exercises are prescribed according to that level of the lipid profile which are increased. Suppose if your cholesterol and your sugar are high, robust exercises are prescribed, and if the cholesterol are normal and there is an increase in the very high density lipoproteins, the people are advised to go for the slow and sustained slow walks. Why? Because with your exercise in a particular set of circumstances, your cholesterol, your VLDL, HDL, VHDL, all these lipoproteins, they make significance towards the selection of the exercise. So, if we summarize it, let's take an example of a race. If the sugar and cholesterol is higher, 100 meter dash is advised. Why? Because it burns a lot of robust exercises, and fast exercises burns lot of cholesterol and sugar. It consumes a lot of cholesterol and sugar, so their level goes down. And suppose if the LDL and and HDL, which are borderline lipids, if they are increased, so milder forms of exercises like cross country race or 1500 meter race are advised, or if you can go in for the marathon. And suppose if everything is okay, but still VHDL is increased, so the slow and sustained walks are advised. So you see at one spectrum there is the very robust exercises, and at the other spectrum there is slow and smooth and gentle exercises. So which exercise suits you? It's the function of the orthopedic surgeons and your fitness specialists to decide about it. Thank you. And till we meet next, till then, it's Radhe Radhe. See you next time. Thank you.